Sa shisen pat kuble ye phi baro bat phidang ye pe ye ka khubor jong u Mawphor. Habengin ye ya che prang bat ka khubor hagani ka por tugin ye pe ye ki mat ke bakongsan jong ka khubor kumne. Wan yuk jat u MP Shasakwang ban singap ye ka jingdon kam ka jingeseng KJP sinot sepngi. Don bon ki brew ki bom patre IT ka ki doctor ki nurse ki nongtre ka hospital sarkar ong u health minister. Hayeng dorbar pensinga u MLA ka nongpo halo ka jing bat ka jing siu yaki asha. Uma Vincent H. Pala, Member Parliament ka Shillong Parliamentary Constituency, jong ka jylla Meghalaya. Menta ka sngi ulalit jurip bat ye kendo yaki pastor bat kitimen basan jong ka balang Presbyterian Sakwang na ka bynta ban penbit penbiang ha ka bayadei bat ka jing penkre ye ka jing seng KGPC not sepngi jong ki rangba ha ka ni ka balang Presbyterian Sakwang ka ban salong usnem araja arpusan. Hadin ka jing lang uma Vincent H. Pala habakren bat kilat patay khubor uloong banakaliang jong u ukwa ban ye kendo markmat bat kinong penya jong ka balang Presbyterian Sakwang na ka bynta shibon ki jing don kam ban penkre ban penbit penbiang na ka bynta ka surok ka umbam umdi ki jaka yeng kali bat kumjuru na ka bynta ban shna ye ka multi-purpose hall jong ka balang Presbyterian Sakwang bat ki weide khnang bakan long ka babit babyang na ka bynta ki pai ba riungai Kristan ki banwan che ka jingeseng ha ka te ka KGP sinot sepngi jong ki rangba ha ka ni gesngi layo ru ban penlong ye ka jingelang balengkot ha ka balang Presbyterian Sakwang ha ka bana kaliang ka balang kalio ban aru ya ka dorkas ne ka memorandum da upaso SS kharjarin harangkat ka jingadon lang ki rangba balang bakuntup naduk kita men basan bat kumju uru kit khot jong ke komiti balang ya ke jingalang la penya dau pastor Dr. SI yau penyau ki jingdwai na utmen basan bi wartede ke jingkren kublei na unongelam bat ke jingdwai penwai dau pastor bi khas emle
kublei sibon ya ka jingadon lang jongpi ke jingwan jong ang ni ka de hadin hakani ka sinot balada pengiwan sinot te EMDC bat pastor ki kwa ba ni de banwan ban yo i lo jong kemat ya kan ni ka jipung kre nam ta ka sinot hau arajar afusan kata kata ngawan ban pek ban ye kendo ikirang ba ban kendo ik pastor kita men basan bangin ye perkat kanu gerkom ngila ban ye trina do manta ke kijing don kam jong ka palang ki sinot kam jong kini ke area kenang ba ka sinot hau afusan kan long ka bajop dan asungu ik pastor san kalom koy si jengi la ai nga ka memorandum persang ban yarap hai bori barit ma nang bingila aga jok por ngala oi ki ban pembiang yaki drawing nam ta ka surok nang bingin ya krancha ka government kai bingila ban le nang ba le na try na kermen ka ni ka sinot ka banwan kan de ka full fledged sinot kam de kom hini ki por bla de ka traffic kan de ka ba way ka light surok badan kam ha kat sobadan sinot sebentar ke di nak tak jipun krek nak tak sinot jiwan jong ahani Lisbon.
Umentri katanat ka kot ka kia ka jylla u James ke sangma ule thu bagi don bon ki daw ki ba penlong ye ki doctor bat ki nurse bat ru ki nongtre ka kot ka kia ha ki jaka ajing sumar jong ka sarkar ban om patre ban ai ye ketika ban yada na covid haba jubab halor ka jingkeli balawan ra daw MLA ka Mawson Ram ha ka dorbar mang tengka uba Himalaya ha ka ni gesngi nengkong Umentri ulai tu bahadu menta kidon hadu araja sauspa sanpun rungut haki hospital sarkar batang saup kendai ngut pat haki hospital private.
Reply to staff question 3. A. Sir, the total number is 2,505, which is about 10% hesitancy rate. B. Sir, based on the study conducted by the Indian Institute of Public Health, IIPH, Shillong, there are various reasons for COVID vaccine hesitancy among the healthcare workers. C. So the total number of unvaccinated healthcare workers in government hospitals is 2,456. D. So the total number of unvaccinated healthcare workers in private hospitals is 49. E. So the government is making all-out efforts to conduct counseling and create awareness programs in this regard.
Yes, Vahimala.
Mr. Speaker, sir, may I know from the Honourable Minister, what is the total number of health workers that are targeted for vaccination?
So the total number is 28,708 healthcare workers, sir, which are serving in government hospitals and 2,000 in government hospitals, sir.
Does that include the ASHAs also, sir?
Yes, sir.
Honourable Speaker, sir, I am privy to a report in my hand which has been conducted by the Indian Institute of Public Health, Shillong. Sir, this survey has been conducted in 4 hospitals, sir. So out of these 4 hospitals, there are private hospitals and the government hospitals. The report says that there are 93 doctors who refused vaccination in the government hospital. Then there are about 462 nurses who refused vaccination. There is about 434 non-medicals in the government hospitals. And when we look at the private hospitals, sir, we have only 43 doctors who are hesitant, and nurses only 144, non-medical 147. So this picture shows that the hesitancy rate for vaccination is more on the government hospitals and the government health workers rather than the private. And the minister's reply itself shows very clearly, sir, in C and D, that the unvaccinated in the government hospitals is 2456, whereas in private hospitals is only 49. So may I know the reason, sir, why there is so much of hesitancy among the government health workers, sir?
Mr. Speaker, sir, so there are various reasons, as I mentioned in the course of my reply, and as per the report of the Indian Institute of Public Health, the IIPH, sir, this was a report via a study which was conducted among healthcare workers and the community. So I will just read out the reasons why people are hesitant to take the COVID-19 vaccine, sir. So, 1, some people are worried about the side effects after vaccination, and this is in descending order of priority, sir. Number 2, sir, messages on social media that cause concern. Number 3, sir, some of them have not yet decided which vaccine to take because there are many choices of different companies which are on offer. So number 4, some of them feel that natural immunity is sufficient. Number 5, sir, some of them are confused by different messages from different sources. Number 6, sir, some feel they have developed immunity against the virus. Number 7, sir, some fear needles and the pain caused by needles. Number 8, some fear that the COVID-19 vaccine may affect future pregnancies. Number 9, so none of their friends or relatives have taken the vaccine, so they feel that they shouldn't also. Number 10, COVID-19 vaccines are not safe. This is, some people feel that it is not safe. Number 11, sir, family members sometimes advise them not to take the vaccine, so they go by that advice, sir. Number 12, COVID-19 vaccine causes infertility and impotence. That is felt by some of the people, and that's why they're hesitant to take the vaccine. Number 13, sir, they feel that COVID-19 infection is not serious, so vaccine is not important. And number 14, lastly, sir, influential leaders do not support the vaccine, thereby they feel the need for taking the vaccine does not arise, sir. So these are the reasons which were spelled out in this report conducted by the Indian Institute of Public Health, and I hope that answers the question.
Mr. Speaker, sir, we understand how important vaccination is against this dreaded disease, COVID-19, sir. And we also understand how much the government is spending a lot of money in creating awareness, publicity. I could see a lot of pamphlets, posters, hangouts, hoardings, asking the people of the state to go for vaccination, sir. Now, when the government on one side is asking the people to go for vaccination, they're forcing the people, they're going door to door and asking the people to come for vaccination. Now, on the other side, sir, it's so glaringly shown that the health workers, even the doctors and the nurses, are still hesitant, sir. Now, sir, what kind of picture are we showing to the people? That when the doctor himself is hesitant, then the public would say, when the doctor is not taking the vaccine, why should I take the vaccine? Now, I'm not here to propagate against the vaccine, sir, but I'm trying to draw a picture giving a contrast of this whole scenario, sir. Therefore, sir, I understand the situations and the reasons that the Honourable Minister has specified just now. Yes, there are genuine reasons like that. But, sir, I see in the last answer, in C or E, that the government says that they have made all efforts to conduct counselling, create awareness program for such hesitant health workers. Now, may I know from the Honourable Minister, sir, how many such health workers have changed their mind and taken the vaccines?
So it's an ongoing process, and how many have changed, to put it into context, sir, will require a certain timeline, which I think the honourable member, if he so wishes, I can provide that.
Sir, may I just, okay, I wouldn't like the total figure as how many, I'll just rephrase it, sir. Like, what is the kind of percentage that the Honourable Minister could give us, that what is the rate of change of mind that is going on? Whether their mind is still stuck not to take the vaccine, or has it changed after the counselling and the awareness program done?
Yes, sir. Definitely, sir. Counselling has helped to a large extent, sir. And we have seen behavioural changes in people due to these counselling sessions, sir. And this is an ongoing process, sir. As we speak, a lot of people are coming forward to take vaccines. This is something that we are not, discontinuing with that process of counselling, so that people, whoever so wishes, can keep coming, sir. And I would say, sir, 70 to 80% of people who were earlier hesitant to take the vaccine have come forward and have forward to take the vaccine. So, but that is over a period of time, sir. So that would be more specific, sir.
Thank you, sir.
Mr. Speaker, sir. So this is a very important time. I may say that from all the 60 MLAs, even the state as a whole, we have to support the health workers in the state. So in spite of that, we cannot deny the fact that in every constituency, even the state, many have come forward and given the vaccination. So may I know from Honourable Minister the total number of vaccinated in the state? In the first dose, how much? In the second dose, how much?
Sir, as of now, sir, I can give in terms of percentage, sir.
Yes, yes.
So the first dose coverage for the first dose, sir, is 70.24%, and the total coverage for the second dose, sir, is at 57%, sir, right now.
So only one more question, sir. So we heard about the reply given Honorable Health Minister. We could see that there's a positive step taken by the Health Department. So may I know from the Honorable Health Minister, is there any health workers in the state you have given about the booster dose, sir?
I'll require notice for that, sir.
UMLA ka nongpo ba Meral Bonds aim hakas ginengkong ulara da ka call attention notice haka dorbar mang tengka jong ka yeng dorbar thawan ke jylla halo ka jing baki asha ke yakindo khamtam haka bai dei bat ka jing sew ba ka sarkar ka ai ka bom ya hapshu bat ka kam ka bakitre haba juba bhalo kani umentri ulong baki don bon ki rukom sew yaki asha katkom ka jing tre kam jongki kentup nadu ka jing sew hakapor bakitre hakapor covid umentri ulong ru bakam dei setia baki asha ki yo tangan rupon ru tengka haka shisngi kumbala pau namar na kaliang ka sarkar ru ka shimkhia bha halo ka jing jongki.
I would like to take this opportunity to thank all the health workers of the state for being so sincere in the duties during the fight with the pandemic of COVID-19. I would like to place on record my sincere thanks to the health department, to the doctors, to the nurses, to all the paramedical staff of the health department. At the same time, to the ASHAs who have rendered their services tirelessly for bridging the gap between the health system and the public at large. The issue of ASHA within our state, it is not a new issue. Each and every one of us, we are aware the problem, the grievances that they have been facing in the past, even till date. We have seen just recently on Friday, they are again on the street to demand for their dues, to demand for a better honorarium, to demand for the better incentive, which should be at par with the service that they are rendered upon the people of the state. Sir, we know that the health department, through different paramedical staff, they have trying their level best to reach out to the people on ground, not only during the pandemic of COVID-19, all the time also. ASHA, they are performing their duties through the MCH department, to the NHM, to reach out at pregnant mothers, children, to make sure that the healthcare system will reach at the ground. The effort that they have been put into, it is commendable, despite of so many hard work that they have rendered. Still, there are few issues that need to be looked into by the health department and the government at large. Apart from visiting each and every household to guide the pregnant mothers, to guide the family who need to be looked into, to bring close to the health system, to the sub-center, to the PHC, to give awareness. At the same time, directly, indirectly, it has a link with IMR and MMR within our state. So it is very important that the issues and the grievances of the ASHAs and the ASHA facilitator, both these two sections, need to be looked into. And I have said in my opening remark, in the past also, they have been on the street. They have been running from pillar to post for their dues, for their incentive. So I would like to request the Honorable Minister, through this call attention, to look into this matter on these few points. For the ASHAs, the fixed honorarium, so far they are getting 2,000 rupees per month as the fixed honorarium. If we divide per day, it will come to around 66 rupees. Compared to the hard work, the service that they are rendered upon, it is not worth to. So, even though we understand that this 2,000 rupees also, it has just been given last year, I would like to urge the Honorable Minister, the department, to look into the matter, to raise this fixed honorarium, if not to 300 per day, also at least to 150 to 200 per day, so that it will come to 5,000 to 6,000. So that is the first point. Second point with ASHA is that with regard to the pending incentive, be it the incentive from the central government, be it the incentive from the state government, the MMBS, Meghalaya Maternity Benefit Scheme, we would like to urge the government so that they will be paid on time, this incentive for the visit from one household to another. At the same time, the incentive during COVID-19, which is need to be looked into, we urge the department, the government, to see that this incentive also will be cleared at the earliest. At the same time, over all these three issues, I would like to urge the government to ensure that the payment for all this honorarium, the incentive to be make it regular so that they won't suffer and wait for so long. The issue of ASHA facilitator, because they work hand in hand, sir, this ASHA facilitator are the one who are looking after the ASHAs, advise them. For them also, the fixed honorarium of 2,500 need to be raised. At the same time, the allowances for their visit, because they are getting 300 rupees per visit and 20 visit per month. So if we look at the present day expenses with the fare of the taxis or the sumos, or sometimes they have to hire vehicle, especially in the rural area, 300 rupees, if we compare to the present days, it is very less. So we urge the government to look into this issue of the ASHA facilitator also, so that they work hand in hand, the ASHA facilitator and the ASHA, so that we can make sure that the basic health benefit that the pregnant woman, that the children has to avail at the ground, we would like to ensure that the government will ensure, the present day government, because the health sector is very important, so that we could see the light of the day within the health sector. Thank you, sir, for allowing me to raise this call attention. I hope that the government and the Honorable Minister will give a reply which will satisfy this August House. Thank you, sir.
Minister Judge, for reply, please.
Mr. Chairman, sir. Thank you. At the outset, sir, I would like to first thank the Honorable Member from Mawphor, Shri Meralwan Siem, for bringing this calling attention notice, because it gives me an opportunity to clear certain misconceptions and certain doubts, and I would like to thank the Honorable Member for having brought this calling attention notice, for giving me this opportunity. Sir, as we all know, sir, the ASHA program was introduced as a key component of the community processes intervention under the National Health Mission in the year 2005. So the ASHA program has emerged as the largest community health worker program in the country, and it is considered as a critical contributor to enabling people's participation in health. So the ASHA is primarily an honorary volunteer, sir. They are selected from the community that they reside in, and they are eligible for performance-based incentives offered under various national health programs as compensation for their work as health volunteers, sir. So in the state, as on February 2022, the total number of rural ASHA are 6,801 and urban ASHA is 250. Total coming to 7,051, sir. So it's pertinent to mention here that the number of ASHA workers have increased from about 6,690 in the year 2018 to 7,051 in 2022. So this increase helps us reach each and every locality in the state, sir. So incentives for the ASHAs for which they are entitled based on their performance are as follows, sir. 1. Under the NHM, sir. These are the ones, namely 6 of them, sir. 1. Reproductive and Child Health Program, rupees 7,651. Immunization, rupees 375. Number 3. Health Systems Strengthening, rupees 1,200. Number 4. Non-communicable diseases, rupees 60. Number 5. Communicable diseases, rupees 1,550. Number 6. COVID-19 incentive from the union government sources, sir, is rupees 1,000. So there are 2 Government of Meghalaya initiatives since April 2021, and these are fixed incentive to ASHAs, which is at the rate of rupees 2,000 per month, and the COVID-19 incentive from state resources, which is rupees 1,000 per month. So with the introduction of the incentives from the Government of Meghalaya, an ASHA is guaranteed a minimum of rupees 4,000 per month, which is excluding the incentives under the National Health Mission, which are performance-based. So on an average, an ASHA is expected to earn an incentive of rupees 5,000 to rupees 10,000 per month, depending on their performance. So, the release of funds is done in this manner, sir. The program incentives under National Health Mission. So this has already been released to all the districts. The fixed incentives and COVID-19 incentives from Government of Meghalaya of rupees 2,000 and rupees 1,000 respectively per ASHA per month has been released to the districts in 2 installments. The first installment was released for payment till September 2021, and the second installment was released for payment till March 2022. So we have acknowledged that there is undoubtedly a delay in these incentives reaching in time to the ASHA workers. Hence, we had promised during last year that we will develop an efficient online claims and payment mechanism, thereby this delay would be reduced drastically. With the support of the National Health Mission, the ASHA and the ASHA Facilitator Payment mobile application has been developed. The sole purpose of developing the application is to ease the payment process of ASHA incentives and ensure timely disbursement of the same. The application will also be an important support tool for program officers at all levels, as it will enable regular monitoring and tracking of ASHA payment and ensure minimum time lags in payments. Sir, the Honourable Member had expressed concern about the delay in terms of payment of these incentives to the ASHA workers, sir. So I would like to hear, for the benefit of this entire House, sir, August House, and also the public at large, sir, would like to just let you know what the old system was and how that old system was very tedious, was a system whereby there were too many processes which resulted in such delays, sir. So the earlier process was basically the ASHA had to fill up a paper-based claim form once a month to keep one copy of the claim with herself and 1 copy to be handed over to the ASHA facilitator. The ASHA facilitator would in turn verify this claim form and then submit it to the ANM. So this ANM would then be verified, the claim form would then be verified by the ANM, and the ASHA facilitator would collect the ANM verified paper claim once again under her jurisdiction and then submit them to the medical officer for certification. The MO would then certify the claim form, and then again the ASHA facilitator would collect the claim form certified by the MO and submit it to the PHC, the Primary Health Center accountant. The Primary Health Center accountant would then prepare a consolidated month-wise payment file and process the same for payment through PFMS from the PHC bank account to the respective ASHAs. Now we can see how tedious this process was, and very time consuming. So now, as I just mentioned, that we have, with the support of the NHM, the ASHA and ASHA Facilitator Payment Mobile Application. Now with this new process, number one, this is through a mobile app, So the claim forms which will be submitted to the ASHA facilitator and to the ANMs will be done on this mobile phone app, and we can see how seamless the process will become and how we will be cutting short on a lot of time wasted in paper forms, moving from one desk to the other and coming back, so on and so forth, sir. Therefore, sir, with this ASHA payment ASHA and ASHA Facilitator Payment Mobile Application form, sir, this application app, So we are very, very confident that the time unnecessarily taken for verifying all these claims would be cut short, and ASHAs would get their payments in a very, very short time, sir. We expect within 48 hours, sir. So this application has been rolled out on a pilot basis in the Umling block in Ribhoy district. And it is expected, sir, to be implemented in the entire state by April 2022, so in 2 months' time. I'm also happy to inform you, sir, that 74 ASHA workers of Umling block have successfully raised their claims and payments and have been made, payments have been made to their accounts within 48 hours of their claims, sir. Therefore, sir, we are very confident that once this is rolled out in the entire state, these payment claims will be settled within 48 hours, sir. So this is one of its kind of application, and this has also been successfully integrated with the PFMS as well, sir. So therefore, sir, to address the concerns of the Honourable Member about delay in payments, sir, I am very, very hopeful, sir. I am very optimistic that with the introduction of this app, this technological intervention, ASHAs will get their payments very much on time, the incentives which are due to them, sir. Sir, I would also like to mention here that the government has released a total of rupees 151 crores in the last 4 years for ASHAs for various incentive purposes, including the pending backlogs of the erstwhile Meghalaya ASHA Benefit Scheme and the Meghalaya Maternity Benefit Scheme, the MMBS. Here I would like to just, for the benefit of this august house, sir, would like to make a comparison between 2013 and 18 and these 4 years, sir, that is 2018 to 2022, wherein, sir, in 2013 to 18, 5 years, sir, only 48.87 crores was released as payment to these ASHAs, sir. However, in the year 2018 and 2022, in these 4 years, sir, 151 crores have been released to the ASHAs. Therefore, sir, you can clearly see, sir, that the system, despite the kind of handicaps, despite the kind of difficulties that the department may be facing, the officers, the health officials, the whole health department has been working very hard to ensure, looking at the kind of yeoman's service that is being provided by the Ashas, that payments are made to them on a timely basis and the due payments are cleared. Therefore, sir, when I say 151 crores which has been released in these last 4 years, these are payments which are inclusive of the backlogs of the previous years, the backlogs of the MABS, that is the Meghalaya Asha Benefit Scheme, which was pending from 2013 to 2018, and also the Meghalaya Maternity Benefit Scheme, the MMBS, which was pending from 2013 to 2018, sir. So, sir, of the 151 crores that has been released, sir, in the last 4 years, about 79.49 crores, that is over 50% of the total amount, has come from state resources only, sir. So this goes to show how serious we are as a government to ensure that Ashas are not neglected, sir. So I therefore urge the members of this house and Asha workers alike, sir, to not believe that it is only rupees 66 per Asha per day. This is something that is very misleading, sir, because I have already explained the kind of the incentives that they are getting, and with the incentives, sir, it comes to about rupees 5,000 to rupees 10,000 just incentives per month, depending on the performance of the Ashas, sir. The program is designed, sir, the Asha program is designed to be performance-based so that there is a genuine motivation to increase service delivery. With the coming of the new online application, so the claims mechanism shall be eased, and I'm very hopeful that the payments will be done at the shortest possible time, sir. At the same time, sir, I would also like to inform the Honourable Member and this August House and the public, sir, that a delegation of the Ashas did meet me, sir, and they have expressed all their concerns, including all the concerns which have been raised by the Honourable Member from Mawphor. And, sir, regarding the increase, sir, of the fixed incentive, sir. So, therefore, sir, I would just like to assure the Honourable Member and this August House that, yes, sir, we are examining this matter. There is a due process, and, sir, we will examine and see how we can increase this fixed incentive to the best possible, in the best possible way, so that the Asha workers can get the benefit of this, sir. So with these words, sir, I hope I've been able to clear most of the doubts which have been raised, or concerns rather, which have been raised by the Honourable Member from Mawphor, sir. And the incentives are in the process of being cleared, sir, and the most recent one being in the month of March itself, that we are clearing some of the incentives, sir, and one installment was already done in the month of September last year, sir. So with these words, sir, I hope I have been able to address all the concerns, and I would like to thank the Honourable Member once again for giving me this opportunity. And with this, sir, I resume my seat. Thank you, sir.
You may seek only one
Yeah.
application.
I would like to thank the Honourable Minister for thoroughly explaining these very important issues of one of the very important component within the health system, the Ashas. We hope that with introduction of the new app and the technology, that the payment for the dues will be faster. At the same time, as the Honourable Minister have replied categorically that the increase of this fixed honorarium also will be looked into. We will look forward that the department will see and will ensure that it will be made in due course of time. At the same time, another issue I have raised is with the travelling allowances of the Asha facilitator. They are very less in number. They are not much. They are getting 300 per visit. If this can be looked into, it will be beneficial for the Asha facilitator. Also, it can be increased from 300 to 500. This is my submission.
So I will get the matter examined, sir.
Jekum tu gila poisha bukut jong katup khubor sa sisin pat kuble shibun ya pibaro tak hadu begini shimbiang kuble shibun.